Hello and welcome everyone. I'm Beth Britton. I support Dementia community with their communications work and I warmly welcome you to this webinar today. We have some excellent speakers and a really interesting topic, so it promises to be an immensely enjoyable hour together. Our speakers are going to tell you all about it and I will introduce them properly in a minute. We are recording this webinar, so if you don't want your face on the recording, please turn your camera off now. Please use the chat for your questions. We may also be using the chat for some polls and things as well, depending on how well the technology works for us today. We will have a Q&A and discussion at the end of the presentation, and we'll be very happy to field your questions then. So please either use the chat or raise your hand and come off mute once we get to the question and answer session. Afterwards, my colleague Beth Lang will email you with the slides. The recording will also go onto our YouTube channel, which is the Journal of Dementia Care, so do look out for that. We will also send you a feedback form afterwards, and we'd be really grateful if you'd fill this in. So a little bit about our speakers today, and they're fellow colleagues of mine because I am a carer rep with MSNAP, so their work is very close to my heart. So we welcome today Holly, Claudel and Rhian from the Memory Services National Accreditation Programme to tell us all about their work with memory services. And over to you, ladies.
Thank you, Beth. And thanks everyone for joining today. So yeah, as Beth said, we are going to be going over our Memory Services National Accreditation Programme. So just to give you a little brief overview of what we're going to talk about today. So we'll give you an intro to what MSNAP is. So MSNAP's a kind of acronym to make our lives a bit easier because it's a bit of a mouthful otherwise. We'll then go over the review process and what that is. We'll go over some findings from a national report that we published recently, which is based on all the reviews we've done of memory services. We'll talk about how we sort of share learning and facilitate shared learning among memory services, as well as some of our membership benefits, and give you a little overview of how to join MSNAP if you're not already a member. So we'll talk about who we are and what we do first. We initially set up a very sort of jazzy Mentimeter to do, but we're having technical issues today, so I think we're going to just keep it simple. But if you could just put in the chat sort of how much you know about the work of MSNAP, or you can unmute yourself, I think, and talk if that's how you'd rather do things. And yeah, you can just say whether you know nothing or not much, a bit or a lot about MSNAP, which would be really helpful for us just to know a little bit of kind of the context that you guys have of who we are. Don't think I can see the chat, so if someone else can read it for me.
Yeah, absolutely. So Sylvia's saying she's a 1, so nothing or not much. Sue is saying not much. Espenos, not sure I've said that right, is also a 1. Trace is a 2, and 1 is a 2 as well. I would contribute, but I'd have to say 3. So
thank you, Beth. Brilliant. Okay, so that's helpful for us to know. So we're going to kind of have to try and strip it back a bit. If you have any questions along the way, just drop them in the chat, and yeah, we can answer them for you, hopefully. But essentially, just to give you some context as to where we're sort of based, we are based at the Royal College of Psychiatrists in their College Centre for Quality Improvement. And the CCQI, which is the acronym there, lots of acronyms, aims to raise the standard of care that people with emotional or mental health needs receive by helping providers, users, commissioners of services to assess and increase the quality of care that they provide. 97% of mental health trusts in the UK participate with one or more CCQI projects, so MSNAP is one of those projects. But the other projects sort of cover different mental health services, but they often run in a similar way. So we've got 28 national quality improvement and or accreditation networks. So they're all the networks that are similar to ours. And then 46 plus projects overall. So we've also got some national clinical audits and research that go on in the department as well. So in terms of MSNAP itself, MSNAP launched in 2009, so it's quite a long-standing network or programme within the CCQI, and it's designed to support memory services to improve the quality of care given to people and their carers. It's not for profit and a voluntary process that services choose to join. Our kind of main aims of MSNAP are to evaluate the quality of memory services using agreed standards via a process of self-review and peer review. We offer accreditation and peer support, offer opportunities for learning and sharing of ideas, and we also help services demonstrate a high quality of care, or high quality care. I'll now hand over to Claudel, who's going to talk a little bit about our membership.
Thanks, Holly. So we currently have 90 members across 45 trusts within the UK, and some trusts have been members of MSNAP for years and have just gone through their 6th accreditation cycle with us. MSNAP membership is open to international memory services on a developmental pathway. So what this means is that we would provide these services with the same support and same assessment tools and resources, and they would still receive a peer review visit from us, but they just wouldn't receive the accreditation, as international accreditation isn't possible from the Royal College of Psychiatrists. Next slide, please. So we offer 2 membership options, accreditation and developmental. And basically the differences in a nutshell is that our accreditation membership is for more long-standing membership, and it's aimed at existing members who are confident they are meeting the threshold for standards, whereas the developmental is more for teams who don't feel that they would meet the standard threshold, or they feel like they would need just a bit more time and support in order to get to that stage. Accreditation membership will be reviewed every 3 years, but developmental reviews take place annually, and this allows for the service to engage in a more focused quality improvement as they work towards accreditation. Teams will not be required to provide any documentary evidence for developmental reviews, but if a service would like to submit evidence for comment by the review team, they are very welcome to do so. And after a peer review visit, the service will receive a developmental report from us, and the report will not be reviewed by the accreditation committee for the developmental membership. And so just to talk a bit more about our standards. So the MSNAP standards are developed in collaboration with member services, advisory group members, accreditation committee members, and other stakeholders, including patients and carers. And what they do is they aim to describe best practice and what an ideal memory service would look like. And these services can use our standards for benchmarking purposes as well. The standards are revised and updated every 2 years. The current edition of standards that we're working with contains 154 standards, and these are spread across 10 different domains. So these include topics such as patient and care experience, staff training and development, clinic environment, information for patients and carers, and psychosocial interventions. So we have 3 different standard types, and these are split into 1, 2, and 3. So type 1 standards follow the NICE guidelines for dementia, and they cover areas where failure to meet them would result in a significant threat to patient safety, rights, or dignity, or they would breach the law. And they involve the fundamentals of care, including provision of evidence-based care and treatment. And because of this, accredited services are expected to meet 100% of type 1 standards. Type 2 standards are areas that the service would be expected to meet, and they would need to meet 80% of these types to be accredited. And then we have type 3 standards, which are more aspirational, and these are in place to encourage new developments in dementia care services, and they would be expected to meet 60% of these to be accredited. So just to talk a bit about our review process, this is what a typical review process would look like. So each organisation would go through a period of self-review. So this would be either 8 or 12 weeks. The self-review data collection includes information about the service, an audit of 20 case notes, distribution of questionnaires to gather information from patients, family, friends, carers, memory service, staff, and referrers. And the peer review workbook is compiled from this self-review data, and the service will also upload anonymized evidence documents, which the peer review team will review before the day. They will then have their peer review visit and receive a service level report from us, and then undergo any action planning to work towards their service development. Next slide, please. So this is what a typical peer review team would look like. So the makeup would be 2 or more clinicians or staff from other organisations, 1 representative from the MSNAP team, and a patient and carer representative. And all of these peer reviewers would have completed specific training with us before signing up to visit another memory service. So we currently have 200 trained peer reviewers, and they're from a variety of different disciplines, including nurses, psychiatrists, occupational therapists, service managers, etc. We hold around 4 peer review training sessions a year, which are free for staff from any of our member services to attend. And then after they complete the training, they can go and visit other memory services across the UK. And I'm just going to hand over to Rianne for the next part.
Thanks, Claudel. So who we are and what we do. So we've got another question for you. What do you think are some of the potential benefits of MSNAP peer review process? And it'd be helpful if you could put that either in the chat or if you want to raise a hand, if you'd like to elaborate on your question. I can't see the chat box, so
I'm watching the chat for you, Rianne. Don't worry.
Thank you. As I say, feel free to put your hands up to speak and add any comments if you'd like to elaborate.
So Sylvia says to ensure residents are getting best practice care.
Absolutely.
It's very much a process about sort of supporting patient and family experiences, isn't it?
Yeah, definitely. And I think from a service point of view as well, it's that safety net that we're maintaining those standards, that it's not a one-off process.
Absolutely.
Yeah.
So Sue says raising standards.
Yeah, definitely.
Emily says a means of promoting consistent quality of services.
Absolutely.
Tracy says monitoring good practices to better practices and raising poor standards.
Yeah, that's one of the things from the peer review, definitely, is about sharing good practice and, you know, sharing across services.
I think I would probably add, obviously, from my experience of working with you, there's a lot of professional development opportunity as well, isn't there, from the process
Definitely.
on both sides for the service that's being reviewed, but also the team that go and do those reviews.
Yeah, sharing of learning isn't there as well. What's worked well in some areas, you know, what's transferable to other services.
Yeah, there's often a light bulb moment where somebody oh, yes, we could go and do something like that, which is lovely.
Yeah, absolutely.
Has
Thank you.
anyone else got anything they want to add in the chat? Oh, one says make a case for further funding in specific areas.
Yeah, that was one of the positives that came out of our first cycle. Actually, we've just gone through our 4th cycle with the college. We were able to get some additional admin support because clinical time was taken up with admin. So that was a real positive thing about bolstering up, you know, the MDT around the services. So some really good thoughts there. So can we move on to the next slide? So why become a peer reviewer? So a peer reviewer is a whole day, a peer review is a whole day dedicated to sharing best practice. People can, examples of best practice to take to their own team. So, you know, We've already touched on some of that, haven't we? It's that opportunity to network. I think, you know, particularly post-COVID, that has been instrumental in getting back out there and speaking to colleagues about services and building those connections. Peer review also gives you that dedicated time to think specifically around quality improvement, to reflect on areas for improvement and discuss ideas with like-minded people who are passionate about dementia care. You know, it keeps MSNAP running. In order for the review process to function effectively, we need to have trained peer reviewers who are willing and able to visit other services. The other positive is, you know, it results in CPD points. It supports professional development in a safe and supported environment. So one of our reviewers highlighted that it's helped gain confidence and built on facilitation and communication skills. So those are just some of the things, you know, that are positives about becoming a peer reviewer. But it firmly for us puts that quality improvement on the agenda. You know, it's that continual process. It's not a one thing, and it involves everybody in the team. So can we move on to the next slide, please? So these are some of the comments about becoming a peer reviewer and some of the feedback. So really positive feedback from our peer reviewers and some of the quotes that we've had. So the whole process was useful. You know, we've already said reflecting, you know, we're all busy practitioners, you know, we don't give enough time maybe to think about those quality improvement and to reflect what's going well, what's not so good, what can always be better. Again, very supportive process. Some people are a little bit cautious that it's a bit of an inspection. It's not. It's definitely, from our experience, certainly, you know, it's a supportive process. We work as a team with the Royal College, with the MSNAP team. You know, it's about sharing ideas, learning from good practice, and keeping that QI aspects on everybody's kind of thought process. So moving on to the next slide, we're touching on some of our findings. So we'll go over some of the findings from our most recent national report, which has recently been published. So if you'd like to read this, it is available on Royal College of Psychiatrists website, but specifically under the MSNAP section. So if we move on to the next slide. So, so from here, you can see memory services adherence to the MSNAP standards at the point of peer review assessment. So, as Claudelle's already mentioned, you know, the different levels of standards. So it's important to note that this is compliance against standards before services are taken to the Accreditation Committee, where they are encouraged and supported to meet a higher number of standards. So by analysing the data at the point of the peer review assessment, this is a true reflection of how teams are meeting those standards. So from 2021 to 2023, on average, services met 89% of the MSNAP standards. So that's quite an achievement, I think. So next slide, please. So the contextual information, as part of the self-review process, we collect a range of contextual information, including caseload size, waiting times, and the number of new admissions. We also ask about staffing, which I'll talk about a little bit more on the next slide. So the average caseload for memory services reached a peak in 2015 to 2016 with a slight decrease, as you can see, in 2017 to 18. So the total number of days between referral to initial assessment has varied through the years, with a slight decrease from 2013 to 2016, and a significant decrease was seen in 2017 to 2018. So all these data is really valuable. So the number of new admissions taken on by memory clinics per week has risen by 130% since 2009. So that is just a reflection, isn't it, of the number of referrals coming through to memory assessment services. So next slide, please. So in comparison to that, the number of staff from 2009 to 2023 has not increased much, with the overall average during this time period being 17 members of staff. An analysis was conducted to understand what memory services teams tended to look like in terms of the range of professional disciplines and the expertise that sits within each clinic in terms of the MDT. And the chart on the right demonstrates the range of multidisciplinary roles across the services. So that's really interesting data as well, isn't it? So next slide, please. So the survey responses, so as part of the MSNAP peer review process, services are required to distribute anonymised questionnaires to staff, patients, carers, to gather their feedback and understand their experiences of the services. So here you can see changes in feedback over time. The percentage is to the right is 2013 to 2014, and the furthest left-hand side is the most recent ones, 2021 to 2023. So again, this is rich and valuable information and data that we have as part of the peer review process. So next slide. So good practice examples. So as part of the national report, a thematic analysis was conducted on all the good practice examples that had come up as part of the peer review days. The main themes that came up were patient and carer experience. This included areas such as communication and information, post-diagnostic support and carer support. Staff support and wellbeing was a really large theme. So peer review teams were clearly impressed with work that was being done around this, especially poignant after the COVID pandemic. So both formal and informal. For example, the supportive management, robust lone working policies, access to wellness and exercise sessions, staff training and skill mix were also commended. Developments of new initiatives was also a theme. Highlights from these included flexible and hybrid ways of working, QI projects on reducing waiting times, collaborative working was another large theme, with lots of services having picked up on this by the review teams, and this was positive feedback. Things that were particularly commended were joint working and liaising with GPs, working with community mental health teams, sharing information systems and transitions between services, collaborative working with other specific services or professionals were also mentioned. So, for example, the wider multidisciplinary teams such as dietitians, IAPT services or dementia nurses, and not to forget our colleagues in third sector services. So the final theme was also clinic environment. So many services were praised for having nice, clean, well-presented environments. Artwork and good meeting spaces were also noticed, as well as good accessibility with clear signage, dementia-friendly adaptations and environments, and a general atmosphere of clinics was also commended on being friendly and calming. So to read more about these, our national report it provides more details, including specific examples from services under each of these themes, as well as related survey responses, and that's been published and it's available on the website. So next slide, please. So the MSNAP team have done a piece of work around the commonly unmet standards and just recently had a webinar on this. So the team collated data from all the peer reviewers, which took place between January 2021 and July 22. And these services were all assessed against the 7th edition of the standards. We identified 8 standards which were found to be the most commonly unmet. And we used some of this data to compile a report which was published in December of last year. So the 8 most commonly unmet standards in depth and addressed reasons why they were unmet, why they are important, and some suggested recommendations around these, and the potential for meeting them moving forwards. So standards addressed included standards around psychosocial interventions, cognitive rehabilitation, cognitive stimulation therapy, psychosocial interventions, creative art therapies, patient and carer feedback, and reflective practice and nutritional risk assessments. So this report, as I mentioned, is available on the MSNAP website or on the Knowledge Hub forum. So next slide is over to you, I think, for the shared learning.
Yeah, thanks, Rhian.
Thank you.
So now I'll talk a little bit about how we sort of facilitate shared learning amongst our member services. So as well as, of course, the review process, which we've spoken about, facilitates that shared learning because we have peers going to visit other memory services. We also kind of have a lot of other opportunities for sharing learning amongst people. So one of the ways is we have an online discussion forum, which is our Knowledge Hub, which Rhian just mentioned our report is on. So this is kind of services or members of services, staff can log on and write questions or comment on other people's posts. We publish all our reports on there. We put all our events on there. So it's kind of like a good place to go for like all the stuff that's available and for kind of reaching out to your peers as well. We also have a mailing list, which is where we share any publications, events, developments, anything like that with our members. We occasionally kind of pinpoint like or signpost even to other events or other publications externally that might be of interest. We hold regular reviewer training, which Claudel mentioned a little bit earlier, and this is so staff in member services can become reviewers. We also hold regular events. So one of our most popular ones would be our annual forum. So this obviously happens yearly and is a full day of presentations from people kind of who are doing really interesting work related to memory services, or kind of we also invite people from our member services to present at those days as well. And we always have really good feedback from them. They're really popular. There's always a real highlight of the year for the team. And then we also have been holding monthly 1-hour webinars, much like this one, on a range of different topics. So we've kind of just finished our round of 2023 ones, but our 2024 ones are soon to be kind of advertised, and we'll be taking bookings for them. So yeah, we can maybe ask Beth and the team to circulate them to you guys. And of course, as we've spoken about, we've got our publications. So the national report, which Rhian's been giving us kind of really detailed data that we've got on there. Obviously, we collect so much data from these reviews, so it's nice to be able to do something with them and present them and show all of our members kind of what's going on, and give them the opportunity to benchmark themselves against their kind of peer services as well. And then our commonly unmet standards report as well, which we've discussed. So I'll move on. Just thinking about our kind of membership benefits. So why accreditation? So we kind of, think accreditation's a really popular thing. You guys obviously gave some really good examples of why the reviews might be helpful for services. But generally, it's really good for promoting quality improvement and sharing best practice. It really helps services plan for improvements for the future. We can help build a community of memory services who can learn from each other, as we've discussed. We allow services to benchmark their practices against other similar services. We demonstrate the quality of the memory service through accreditation. So I think this can be quite a helpful sort of stamp that patients or people that are kind of looking at the service can see that a service is accredited and kind of have a little bit of trust in them, which I think can be really helpful. Also encourages a culture of openness and creates a model of engagement as well. We've kind of covered most of what our membership benefits would be, so I won't go into too much detail about this, but being a member essentially means that our services get to use our additional member benefits, as well as going on the reviews and being reviewed themselves. So they also have the comprehensive report following a review. So once they have a review, they have a service-specific report which covers everything that would have been discussed on the day and all their self-review process and all their recommendations. It's kind of all in there, which they have, and they have that every time. They also get the opportunity to visit the other member services. They get the involvement of our patient and carer team. So we've got a group of patient carer reps, such as Beth, who's on the call, who are really instrumental in lots of the work we do. They come on reviews with us and help us kind of develop tools and things like that. They're really valued, and I think a really nice we've got that voice throughout the review process as well. And then all the opportunities for shared learning, which I mentioned a couple of slides ago, so I won't go into detail of those. So we've had some really great feedback from our members. Obviously, Rhiannon went over some feedback from kind of reviewers earlier on, but these are from our services who have gone through the process. So some examples, we anticipated the feedback at the end. One strength of the MSNAP process is the ability to meet with and engage with other clinicians to learn from good practice nationally and incorporate into our own practice. This is a valuable experience which helped me think about the service I work for and how we can improve things, as well as things we do well. The review process is really helpful for sharing ideas on service developments to improve the experience of people being assessed for their possible dementia and their families. It was an excellent experience, and the sharing of ideas with the review team has given our service some ideas and QI aspects to take away and build on. So just some examples. I think that kind of summarizes nicely what we've discussed, and you're hearing from our members what they like about it, not just from us kind of tooting our own trumpet. If anyone on the call is part of a memory service and isn't a member but interested in knowing how to join, or think they know someone who might be interested, you can visit our website where we've got a lot of information about the different membership options and how to join, or you can drop us an email at msnap@rcpsych.ac.uk. I think Claudel might put these links in the chat so you can easily access them. But yeah, once you get in contact with us, we can give you information on the cost of membership and give you a joining form to fill out as well. We finished quite early, which is always good to get some time back, but it also means we have lots of nice time for questions. So yeah, I don't know if anyone has any. I can stop sharing my screen so I can see the chat as well.
Thank you very much, Holly, Claudel and Rhiannon. That was really interesting. I hope everyone on the call has found it really useful as well. Before we get into everyone else's questions, I actually have one, because we're really interested, Dementia community, we're really interested on who we've got on the call today, and are you connected to a memory service? So if you joined us because you work for a memory service, or if you joined us just because you're really curious about MSNAP, we'd really like to know, just to get an idea of who's with us today and what your background is. And please also, so pop that in the chat if you can. And also any questions for the MSNAP team would be really good. While you're thinking of those, Rhiannon, I was really shocked by one of your statistics, and I don't know if I've heard it right, so I'm going to check with you. I have got a cold, I'm a bit blocked up at the moment, so I'm going to check with you. Referrals have risen 130% since 2009. Wow. We've all seen the news, we've all seen that referrals are increasing, but 130%.
Yeah, and I think if you compare that, Beth, that there's been hardly any additional resources within teams.
Yeah,
so, there seems to be a disparity, doesn't there? Yeah.
Yeah, massively. And just to clarify, that 130% is just information taken from your membership, isn't it? This is not every memory service, because not every memory service is an MSNAP member. This is a voluntary process.
Absolutely. Yeah.
So that is quite shocking.
Yeah, but it does mean, doesn't it, that hopefully that we're breaking down those barriers, that people are seeking diagnosis sooner, and breaking down that stigma as well, and that that brain health and well-being is as important as physical health, isn't it? It's not just accepting it as the normal part of aging. When people are a bit more proactive, maybe to go and seek that referral. So if we view it in that positive light, but yes, it's quite phenomenal, isn't it, when you look at that statistic, really. But begs the question, doesn't it, where we're going moving forwards, you know, in terms of investment into services to be meeting those needs.
Absolutely, that is incredibly important. And I think it just really strikes me. You mentioned obviously awareness has grown. So obviously we've had a lot of campaigns from Alzheimer's Society, Dementia UK, Alzheimer's Research, sort of highlight, you know, when you start to see changes. I know you work in a memory service, Rian. Do you see people presenting earlier now?
We do. We are seeing people who necessarily don't meet the threshold for a formal diagnosis of dementia. But again, we view that as a positive, that people are being proactive. We can start having those conversations about living well, you know, and maintaining brain health and well-being. So that agenda, but also, you know, that people see it as, you know, as important, as I said earlier, but that breaking down those anticipatory anxiety barriers to seeking memory assessment referral. So at least, you know, if we're seeing people really early on, and that's going to be key moving forwards as well, isn't it, with the new treatments on the horizon. You know, we do need to see people a bit sooner, because that was a piece of work that we did with some of our GPs, and that was one of the questions they brought to us. We're never quite sure when we should be referring people to memory assessment services. Well, if somebody's presenting with a memory issue, then surely, you know, it's that at that point, isn't it, that you should be considering a referral to memory assessment service.
Would you say you're seeing more people that are now diagnosing with MCI because they're not meeting the threshold for
Yes.
Alzheimer's, vascular, etc.?
Yeah. And, you know, I've worked in memory assessment services for 12 years, and there's certainly a change in that time. So hopefully, you know, it is about having those proactive conversations, regardless of whether, you know, whether that is with a third sector or the health and promotion and that public health agenda. You know, people, I think, are a little bit more comfortable in having those conversations.
Yeah, and there's been some great work done in September, I think, with the World Alzheimer's Month, talking about that prevention agenda, the things you can do. Hearing loss, your biggest modifiable risk factor. Amazing.
Absolutely.
I know that's not new. I know that's not new. That came out in the Lancet a few years ago, but it's still just wow for people, I think. People don't view it that way.
No, and we've been lucky to get, you know, get that embedded into the memory assessment pathway. So anybody that's referred to our memory assessment services, we have dedicated audiology now as part of that assessment. So and that intervention, just in terms of quality of life, isn't it? You know, even if it's not a dementia, surely, you know, that again is about making every contact count, isn't it? So if we're seeing people for that memory assessment service, if that is an issue, if hearing's an issue, then at least we can get that intervention in place.
Yeah, that's a key part of, I think, that sort of really positive holistic model that we see within MSNAP services that go further, that think further, that are very dynamic in what they offer. While Rian and I are having a lovely chat, and hopefully everyone's learning something from this, if you do have any questions or comments, please do put them in the chat or raise your hand. You're very welcome to come off mute. I was also going to say to you, Rian, I mean, diagnosis is just so important, because it is the start, isn't it? If we get diagnosis right for people, it makes such a difference to how they're going to go on to live. And one of the things that's really struck me with the MSNAP process is, yes, of course, we look at how people are diagnosed, but we also look at that post-diagnostic offering. That's really great now, isn't there? There's some really good stuff that's happening in some memory services that is being offered to people that is really positive. Another reason for people to come forward and actually say, you know what, I am concerned I might be developing dementia, and not feel that actually there's nothing we can give people, because actually some memory services are doing some great stuff in that area, aren't they?
Yeah, and I think that is an area that has also developed over the last 10 years, I would say. You know, working creatively, it doesn't have to be a health need, does it? You know, it's looking wider than that, looking at our third sector colleagues, certainly in North Wales, we've there's a memory support pathway, so that's multi-agency working together, you know, to provide pre and post-diagnostic support for the person presenting with memory issues, but also their carers, relatives and loved ones. So yeah, that's made a huge difference. So again, you know, even if it's not a formal diagnosis of dementia at that point, if it is a cognitive change or MCI, that support is there. And again, that safety net is there then, isn't it, for everybody?
Absolutely. And I know that it's a lot more than just a bit of CST these days, isn't it? We've got services that are providing music sessions, doing life story work, reminiscence, supporting people, younger people. There's a lot of diversity, isn't there?
There is activities, again, you know, we've got some dementia active, you know, in leisure centres, you know, there's all kinds of things going on. So, yeah.
Alison has put a fabulous long message in the chat. Thank you very much, Alison. That's fabulous. You asked where we are coming from. She said, I work in the NHS with elderly patients with dementia. My mother had Alzheimer's disease and vascular dementia, and we were involved with memory services 10 years ago. I enjoy engaging patients in interaction and activities when able, informed by my experiences. That's just super. I think I've met so many people. I come from a personal background of caring for my dad. So I think when you've got that extra personal level of experience, it just adds another layer of expertise, which is just invaluable. And again, I think that's why MSNAP engage a lot with patients and carers, and we are reps. And George Rook, who is a friend of Dementia Community, is one of our patient reps now. I think George was at Congress recently, and he's one of our patient reps on MSNAP, which is just fabulous. I feel like I'm wearing two hats today, an MSNAP hat and a Dementia Community hat. Does anyone else have any other questions, any comments, anything they would like to ask Holly, Claudel or Ian? Anything you want to know about dementia diagnosis, bearing in mind Rian works in memory services, so she would be your perfect person to ask a question to. Sylvia, you've got your hand up.
Okay, I'm not sure if you can hear me. I'm the one that got cut off, so my internet's unstable. So it's a little bit personal, so I'm not sure if it's appropriate to ask. I'm actually in South Africa, and I'm a semi-retired OT since COVID, but I've worked with dementia for 40 years, and I'm voluntarily running support groups and activity daycare at my old practice and things like that. Would I kind of classify, or what's the word, meet the requirements for membership, or how do I get to just find out things like your standards so that I can ensure that what I'm doing, is the right thing?
Holly, hopefully you've heard Sylvia's question, and I know that you've engaged with colleagues in Australia, so I don't know if you want to elaborate a little bit on that.
Yeah, I can try. It's mostly Gem's been doing that work, but we have been working with colleagues in Australia to help them develop sort of a similar sort of set of standards for the work that they're doing over there. And we have an affiliate membership where services can join and access our kind of everything apart from the reviews, basically. So international services can join that, but our members are always kind of whole services rather than individual specific. But if an individual like yourself wanted to access things, our standards and our reports and everything are on our website, so we've got that sort of thing. If there was anything extra you wanted, you could drop us an email and we can see what we can do to help you with.
Oh, that would be wonderful. Thank you.
Super, thank you. I'm just going to repost into the chat for you, Sylvie, just the MSNAP email address that Claudel very kindly put in about 2 or 3 messages ago. I've just reposted that for you now, so you can contact the team directly.
Thank you.
And Alison is asking, do MSNAP visit hospitals?
So we visit the memory services depending on where they're based. I think some haven't visited huge amounts, but I'm fairly new in the role. But correct me if I'm wrong, I think sometimes they are based in hospitals. But we a lot of them are done online now, kind of post-COVID, so they're done virtually, and we visit the services kind of in a virtual space. So we have meetings online with people, but we do have in-person ones as well, where we will visit and have meetings with managers, meetings with staff, meetings with patients and carers, and do a like tour of the service as well. And when that's done virtually, we'll get a video of the service or pictures of the service, so we can kind of score those standards as best we can virtually.
Yeah, a lot of environments are in hospitals, aren't they? Or sort of the outpatient areas of hospitals where you can never find the parking you need. Thank you very much, Alison. Does anyone else have anything? Oh, brilliant. M. Grant. And I don't know what your first name is, so I apologise for calling you M. Grant, but I'm going to read your message. Memory assessments are provided within so many different settings, including standalone MATS services and within mental health services. Obviously, this depends on local commissioning. Do the panel feel a national agreement would be helpful for the future? Maxine, your name's Maxine. Maxine Grant. Oh, Maxine, I think I've done a review with you. I suspect, I have a feeling, I recall your name. Do the panel feel that a national agreement would be helpful for the future? I suspect that Maxine's meaning a national agreement for all memory services, because they're not all MSNAP members.
Suppose we would love it if all the services became members. Yeah, I think it would be helpful. I know some of the quality networks and the accreditation networks within our department, the NHS England sort of mandate them to be members, would be wonderful. But I think a lot of services are constricted with budget and time and things like that, so it's not always possible for services to sign up. We are sort of against that sort of thing. Don't know if Rhiannon or Beth, you have anything to say, or Claudel?
I think I would probably add that I think from a patient and carer perspective, I think it would be wonderful to have a set of national standards that all memory services adhere to. Why should my local memory service be so much better than the one down the road, or vice versa? Everyone deserves equal access to excellent diagnostic and post-diagnostic support that is measured against a really great set of standards. So I would argue, I think it would be fabulous. I'm not sure it'll ever happen, as for the reasons you said, Holly, but I don't know what you think, Rhian, but I'm sure you're going to agree, aren't you? It's, why would we not want that? I think Rhian's trying to come off mute.
Yeah, I am. Yes. And it's very interesting because that is something, you know, because our memory assessment service is based in Wales, that Welsh Government are looking at a standardised dementia standards for Wales. You know, they are 20 standards, but, you know, but it firmly puts those standards out there, doesn't it? And the expectation is that all memory assessment services will work to these 20 standards. But it's just not just for memory assessment services. So it covers inpatient, any dementia service really. But, you know, we've done it the other way around. We've done the, you know, as I mentioned, we've done our 4th cycle now. So we were first accredited in 2015. And I think that's been key for us. It just keeps that QI agenda going, and it's not seen as a one-off process. So we have our peer review and we wait for the report to come. So as soon as that report lands, we're looking at what developments we can make. And I think people get a little bit hung up about funding and we can't do this because we've only got, you know, this many staff. It's about thinking differently, I think, because we haven't had, apart from the admin, we haven't had any investment in any additional clinical staff. So it's just what small scale changes can we make that will make it better for patients and relatives, you know, and their loved ones. And essentially that's where that QI agenda comes from, isn't it? You know, so you don't need huge amounts of funding to be making small scale changes that'll have huge impact. on the people that use and make use of our service. So the that case example about embedding the audiology into the mass service, you know, we got a very limited amount of ICF funding to trial that out, and then we're able to secure additional funding. And, you know, it is essentially a part-time audiology post. So again, that's made a huge difference, and we've been able to spread and scale that then across the whole of the health board into every single memory assessment service. So it's about starting small and just continuing with that quality improvement agenda, I think. And I think that is the key, that the MSNAP process and that support have given to us is giving us that permission to be making those changes and making things better and providing better outcomes for patients and relatives.
Because the world doesn't stand still, and we do need to move forward. And as you say, quality improvement is absolutely vital, and it is something that is very much encouraged within the MSNAP process. And as going back to Maxine's question, it would be something that every memory service would benefit from. And Maxine says there is such disparity across the country, and I think there is. I know we heard from George on one of the first meetings I joined since he became a carer rep, saying about his local memory service and how he wanted to pull them up by their bootstrings because he really felt they needed it. And that's just so important. It is the start, isn't it? When you start to experience symptoms and you go and present with your GP and you go to a memory service, that experience in that clinic is going to influence a lot of what goes on to happen for you. And that's just so incredibly important. Has anybody else got any other questions? Okay, I think we might give you back 6 minutes of your day. If no one's got anything else they want to ask, just to say a huge thank you to Holly, to Claudel, and to Rian. We missed their colleague Jem today. She's not well, so we send get well wishes to Jem as well. We thank the MSNAP team very much for joining us, and also to all of you, our guests today, for joining us. We hope you found it a really useful webinar. Do look out for the information on email from Beth Lang, in terms of where you'll be able to find the recording and where you will get your feedback form. And then just a little heads up for our next webinar. So this will be on Tuesday, the 30th of January at 2 p.m. And it is entitled Innovations in Care and Culture, the Montessori Way Using Dementia Care Coaches. And we will be joined by Lynn Fair, who is very much a friend of Dementia Community, alongside a representative from Milford Care, who are a care provider. So we shall look forward to hopefully seeing quite a few of you on that webinar. And thank you again to the MSNAP team for this afternoon.